Dr. Farah, welcome to Nightside. How are you?
I'm doing well. Great to be on your show.
Our pleasure, that is for sure. Now, you do not bring a lot of good news here, but I think it's important to know you're a cardiologist and a board-certified invasive cardiologist. How are you?
I am doing well.
I can understand stress in people's lives can bring on, cardiac problems when all of a sudden something's going wrong in your life, either with your job, with your family, and there's stress and all of that. How is it that presidential elections also catalyze more cardiac activity than we otherwise would like?
Presidential election is no different from any other stressful situation. It really comes down to the risk factor of stress. Sudden stressful situations can precipitate a heart attack. We've known that for quite some time, and especially the recent study that was presented at American College of Cardiology. The data that was presented in April, just last month, actually confirmed that, yes, stress, in fact, can destabilize the plaque, which is what fills in the blood vessels and causes a blockage, can be disrupted in the setting of an acute stressful situation and can break off and cause an acute heart attack by blocking off the entire artery and abruptly stopping blood flow to heart muscle. That is the definition of a heart attack, and that risk goes up by significantly more in a stressful situation in certain population who are more genetically predisposed. So
I can understand the stress of daily life. I can understand the stress of driving in heavy-duty traffic 5 days. Not that I have to do that, but broadcast from home now, so that's fine. But I look at people who are, you listen to the traffic reports in the morning, and Route 93 is backed up, and Route 128 is at a standstill, and you say, oh, thank God I'm not in that traffic. So that stress I understand. But why do people get so worked up over something like a presidential election? And I know that it's important, and people are rooting for one candidate, the other, or maybe a different candidate. Does the stress level at election time get anywhere close to the stress level that we feel in our personal lives?
In my opinion, it should not, but I can see how it could, especially those who are very close to politics and they're close to their candidates. I could see how it could be very stressful for them. But I agree with you. No matter what the circumstance, we shouldn't allow ourselves to get to a point where we're so stressed out that we could have a potential heart attack. So my advice to everybody would be to take it lightly. Yes, it is an important decision, but it shouldn't be taken in a personal way.
Yeah, the other thing, too, is that the impacts in your life, if a child is sick or if a parent is dying or whatever, or if you lose your job, those are real stress factors. And we talk politics here all the time on my program because it's a talk show. And I know that there are people who are fervently supportive of this candidate or the other candidate. And I know that look, we've had some very difficult circumstances, whether it's January 6th or some of the other allegations that go back and forth. But people should just, I think, take a deep breath because, is there a period in people's lives when heart attacks really become something they should be thinking about? At what age should someone really be thinking about maybe being seen by a cardiologist? How are we trending earlier in that than we have in the past?
We certainly are. So in the past, we used to say, above the age of 50 or above is really when you really are at risk, especially those who have risk factors like high blood pressure, high cholesterol, diabetes, and family history, that they ought to go get their hearts checked by a cardiologist. But that's no longer true. The recent data shows that we are it is definitely uptrending, and especially post-pandemic, we have some research and data that came out that shows that in the young group that we typically tend to ignore when it comes to heart disease, between the age group of 25 to 43, there's an increase of more than 40% in the rate of heart attack, which is data that we saw post-pandemic. Now, whether this has to do with the pandemic itself, the virus had anything to do with it, we don't know. It's highly likely. But regardless, that is the trend we're seeing. And so I would say that checkup period should be much earlier now.
And I assume you do that, you get to a cardiologist through your GP, your general practitioner, and you express some concern, and they will then set you up with the meeting with the specialist, with the cardiologist.
That is true for majority, and but you don't necessarily have to. It all depends on what kind of insurance you have. So those who have Medicare, for example, like straight Medicare, they do not have to go through a primary care provider. They can go directly to a cardiologist or any specialty for that matter. Also similar to those who have PPO insurance, they also do not need a referral, so they do not have to go through their PCP. They can just go directly to a cardiologist. It's only those who have HMO, they are required to go through their primary care physician or provider because they would require a referral.
Well, Dr. Farah, thank you for that clarification, and thank you for joining us tonight, and we'll love to have you back anytime talking about these sorts of issues. Welcome to Boston.
Thank you so
Welcome to
much.
Nightside. Okay, thank you so much.